Hello, 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 class. Good evening, good morning, whenever you're listening to this. Couple things I wanted to mention to you. This class is not a typical way of teaching this class. Normally we'll meet face to face and I'll give you guys opportunities to stop us instructors and ask questions and have group discussions and things of that nature. And unfortunately, we're not able to do that this class. So that just kind of emphasizes the importance of you guys taking the time to really read through the book, come back and review these videos, send us emails, questions. When we get together, bring your questions. We always encourage that because unfortunately, we're not able to do that in person. So without further ado, we will talk about chapter 7, ventilation, perfusion, and shock. Some of this stuff is kind of in depth. We will stop and really dive into the most important things you guys need to understand to become EMTs. A lot of the nitty-gritty details, cellular structure, things of that nature, we're gonna kind of breeze over them, but it is important for you guys to go back and really kind of dig in on your own time, okay? So with that, we will get started. All right, we'll talk about the cell, the cardiopulmonary system, we'll talk about shock, the pathophysiology of other systems. So introduction to pathophysiology. It's the study of how disease processes affect the functions of the body, okay? This should help with recognizing changes in patients going through due to an illness or injury. So if you understand what is going on with the patient and the changes that are happening in your patient, we don't diagnose as EMTs, but if we can get an idea of what's going on because we understand the systems, then that can help us treat the patient better. Okay, a quick overview of the cell itself. Cell has a membrane that protects and selectively allows water and other substances in and out of the cell. The mitochondria convert glucose and other nutrients into ATP. Okay, ATP is the fuel for cell functions. Without ATP, many of the cell's specialized structures cannot function. All right, here's a picture of the cell. You guys can pause this video if you want to take a quick look at it. Again, there's a lot of detail here, things that aren't necessarily that important as a basic EMT to understand. All right, water. So water is very important. The cell needs water on the inside and the outside of the cell. Okay? Too little water, the cell can dehydrate. Too much water, you can interrupt the cellular function. So you're kind of watering down the system, and there's supposed to be a good balance. And your body's real good at maintaining that balance, but sometimes things can happen and affect that, and that can help us figure out what's going on with the patient. Okay, water also affects the levels of electrolytes, impacts electrical function. So if you're watering down your system, or you don't have enough of those electrolytes in your system, you could have, well, a lot of issues, but a lot of them are related back to heart problems. Some dysrhythmias and that heart skipping beats and heart problems are related to electrolytes. Okay, glucose in the cell. Glucose is considered the building block for energy. We need a supply of insulin, and it must match the body's glucose requirement. So when we get to the altered mental status and diabetic section later on, we'll talk more about glucose and how insulin works in the body. All right, oxygen. There's two types of metabolism. Aerobic metabolism uses oxygen, and anaerobic metabolism does not use oxygen. But when it doesn't use oxygen, it creates a lot less energy, more waste, and the body can become acidic and impair body functions. Okay, and here's a quick picture of the oxygen in the cell. Okay, so this is aerobic metabolism. Okay, so we're using oxygen. I don't know if you guys can see my cursor, but we're using oxygen here, oxygen, glucose, and we create that ATP energy. okay? When we don't have oxygen, the glucose can still get in the cell, but it's a small amount of energy that we can create lactic acid. Now, if you think about, if you guys have ever had your foot fall asleep or your hand fall asleep or anything like that, when you're cutting off the blood supply, you're cutting off oxygen to that area of your body and it gets real tingly. What it's actually doing is it's building up this lactic acid in that part of the body that's tingling. And it can be really bad for the body. So for example, if you can get compartment syndrome. And compartment syndrome is when the crush injuries, you think about a car falls on somebody's legs and they're under there for a long period of time. All that lactic acid is building up, distal to where the crush is. And if you release that quickly, that lactic acid can go through your body real quick and it can actually go to your heart and cause a heart attack. So the same thing with tourniquets, and we'll talk about that later on in class also. But when you put a tourniquet on somebody, the whole point is to cut off circulation to that extremity. But we're also building up lactic acid in the distal portion, distal to where that injury is. And we cannot release tourniquets, but that's why doctors have to do it, and they have to do it a certain way and real slowly, and they have to inject some sodium bicarb and things like that. But that's above our pay grade. But just so you guys understand, that's what we're referring to with the anaerobic versus aerobic metabolism. Okay. So many diseases can alter the permeability of the membrane. That's the ability to let nutrients and glucose in and out of the cell. Ineffective cell membranes can allow substances into the cell that shouldn't be there. So that protection around the cell actually keeps certain things out. It lets certain things in. So certain diseases can really affect that and mess up your whole system. These substances can interfere with the regulation of water. Again, there's a certain balance of water that your body needs. And if you let too much in, or you get too much in, or too little, that is not good. I apologize if you guys can hear in the background. I am doing this in my office at work, and you can sometimes hear the dispatches going on behind me. All right, the cardiopulmonary system. The respiratory and the cardiovascular systems are working together, which is what we talk about, cardiopulmonary system. Cardio, card being the root word being heart, and pulmonary being lungs, and they work together, okay? So they bring oxygen into the body through the lungs, they distribute that oxygen to the cells, and then that also removes waste products like carbon dioxide. That's what things we're breathing out, okay? Any breakdown in the system can result in failure. Right to the airway here. All right, this is more important for us to pay a little more attention to, okay? Because there will be test questions on the bronchi and just certain A and P type questions of the airway. But in this diagram here, this is the lower airway. All right, we have our larynx, trachea, breaks off into two bronchi, and then down into the smaller bronchioles. Okay, and at the end of those, and we'll talk about this in a little bit, are the alveoli, okay? Which is right here. So these are pictures of the alveoli. Okay, these are the little air sacs that actually the gas exchange actually takes place in the alveoli. So when you breathe in, the air goes down into these little sacs, and then your body will pull oxygen out of the air, and it will also deposit carbon dioxide out into the alveoli, so you off-gas that. So when you exhale, that comes out, okay? And certain diseases of the alveoli, COPD and emphysema and lung issues like that affect the alveoli, and it affects their ability to for that gas exchange to take place, okay? So the airway itself, the patient must have an open airway for the system to function. Now that kind of makes sense, right? You'll hear people refer to an open airway as a patent airway. That's just saying that the airway is open and it's secure and it's good. It means there's no issue with the airways, okay? Upper airway obstructions are pretty common. caused by foreign bodies, infection, or trauma. A lot of times that's you're choking on food, things of that nature. Kids can eat a quarter or something, and then that can cause an upper airway obstruction. Okay, the lungs themselves, they're part of the lower airway. Okay, there's a couple different calculations that are used. Again, these are things that are kind of above our grade. We're not going to be calculating these things, but it's kind of important for us to just understand this is how we figure out, volume of air and things like that. So we have our tidal volume. Okay, a tidal volume is the volume of air moving in and out during each breath cycle. So that's how much air and volume comes in and comes out of your lungs. Okay, so if we times our tidal volume by our respiratory rate, that equals our minute volume. So this is the amount of air moved in and out of the lungs in 1 minute. Okay, so some definitions for you. You guys should know the definitions of what tidal volume is, what the minute volume is, all right? And when we talk about vital signs, which is coming up at some point soon, we're doing that on the 1st of October. You'll learn a little bit more about taking respiratory rates and how to calculate them. It's very, very simple, but we'll talk about that later. Okay, the lungs. Any change in tidal volume or respiratory rate reduces the minute volume. That just kind of makes sense, right? So if the volume of air going into your lungs changes, or the rate in which that air is coming in and out, that's going to reduce the overall minute volume. Okay. Respiratory dysfunction occurs anytime there's something that interferes with minute volume. Okay, so your respiratory system is not working properly if one of those two things happen, be it a respiratory rate or a tidal volume. All right, respiratory dysfunction as a disruption of respiratory control. Respirations are controlled in the brain by the medulla oblongata. Okay. Any event impacting function of the medulla oblongata can affect minute volume. That can be an infection. It could be drugs, toxins, trauma. So there's a lot of different things that will affect your respiratory rate. Is really what this is referring to. Okay. Certain infections will, yes. What we see mostly is drugs. When you take heroin, it knocks out your respiratory drives. Your body just doesn't think it needs to breathe anymore, and that's how people overdose. It's not the heroin itself that's killing you. It's the fact that you pass out from taking too much heroin, and then your body just stops. It says, oh, well, we don't need to breathe anymore. And then you essentially suffocate. All right. Certain toxins can affect the respiratory rate and trauma. So head injuries, that's a good indicator of a serious head injury when the respiratory rate is affected. Respiratory drive, I should say. It can be a rate change. So a normal person, and these are numbers you guys need to know, but a normal adult respiratory rate is 12 to 20 breaths per minute. So what you'll see in certain trauma is either a real fast respiratory rate or maybe a real slow respiratory rate or something that's all over the board. So it could even be like breathing fast, breathing fast, breathing fast, breathing fast, really slow, and then it comes back. That's a real good indicator of a head trauma. Okay. All right. Disruption of pressure. And this is when we start talking about pneumothoraxes and things of that nature. But if the wall of the thorax, which is the chest, is compromised, that's a puncture, rib fractures, okay, things of that nature, trauma. The ability to inhale and exhale is impacted and the minute volume is reduced. Okay, and we will talk more about the pneumothorax and what they're really talking about here, and how we can identify that, because that can be fatal pretty quickly if you're affecting the wall, the lining of the thorax. Okay, the air or blood accumulating in the chest or the pleural space also compromises respiration. Again, you're getting air into your chest cavity, and that can collapse your lungs, and that could be air, it could be blood, okay, that's filling up your chest cavity. So these are things that we need to identify quickly because it can kill somebody very, very, very fast. Okay. Disruption of the lung tissue, trauma or medical problems can compromise the ability of alveoli to exchange gases. Again, this is the COPD, the emphysema, certain lung diseases that I was talking about earlier, but trauma, of course, can affect that as well. That means less oxygen is getting in, less carbon dioxide is getting out. It can result in low oxygen levels called hypoxia and high carbon dioxide levels like hypercapnia. So think about your medical terminology. We have hypo and hyper, hypo being low, hyper being high. Okay, the oxia, of course, is oxygen, and capnia would be the carbon dioxide levels. The hypoxia is something that you guys really need to know. It's a term that's used very frequently throughout this class. Hypercapnia, not as much. We don't monitor the carbon dioxide levels in the body as a basic EMT. The paramedics do. So it's something we need to know is a thing and that it is monitored on the EMS level, but not us as EMTs, as basic EMTs. Okay, but hypoxia is very important. That's actually the leading cause of altered mental status. And again, we will talk about that in a later class. All right, respiratory compensation. The body attempts to compensate for gas exchange deficits. Okay, chemoreceptors detect changing oxygen carbon dioxide levels, and the brain stimulates respiratory system to increase rate and or tidal volume. So if the body says, whoa, 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 something's off here. We're either low on oxygen, we're high on carbon dioxide, something's out of whack. The body tells the brain basically that we either need to breathe faster or we need to breathe deeper because our levels are off right now. And that can be an indicator to us as basic EMTs. Again, if somebody's breathing real deep or real fast, something's off in that carbon dioxide oxygen balance. Okay. All right, we'll talk about blood a little bit. Okay, there's 4 parts of the blood. There's the plasma, which is the liquid in the blood. There's your red blood cells, which contain oxygen-carrying hemoglobin. Okay, so the oxygen gets transported through the red blood cells. Then we have our white blood cells, which fight infection, and platelets that form clots. Okay, without enough blood, oxygen and carbon dioxide cannot be properly moved around. So if somebody bleeds out, okay, they're not getting enough oxygen throughout their body. If they're dehydrated, again, we were talking about the water balance earlier. It's very important to maintain that water balance. Okay, anemia is another condition where you don't have enough red blood cells, or liver failure. This can mess with your whole blood circulation system, and your oxygen and carbon dioxide are not getting transported around your body as well as they're supposed to. There's a lot of other nutrients that get transferred around your body above and beyond oxygen and carbon dioxide. But the most important that we're talking about here are those 2 elements. Okay, glucose is another one that gets transported around your body. Okay, blood vessels. So when we talk about blood vessels, we're talking about either arteries, veins, or capillaries. Okay, and each of them have their own challenges as far as trying to control that bleeding if there is some type of trauma to that area. But basically the way the system works is the artery carries oxygenated blood from the heart to the body. Okay, the oxygenated blood goes through the capillaries, and then it goes back to the heart and the lungs to get reoxygenated, if you will, through the veins. So the artery is the high pressure, bright red blood coming from the heart. It works its way through the capillaries, and that's where the gas exchanges take place. Like I told you in the alveoli, remember I said the gas exchange takes place in the alveoli. Those are capillaries inside there, right? And then once he spends all the oxygen, the deoxygenated blood goes back to the heart and the lungs through the veins. Okay, 3 types of blood vessels. Okay, again, I just said this, takes oxygenated blood from the lungs via the heart to the capillaries, where gas exchanges take place in the blood vessels. I said that. Then we return blood to the lungs via the heart for gas exchange. And we'll talk about the whole flow of that in the cardiology section. Okay. The blood vessels themselves need adequate pressure to make the cycle work. Okay. Now, pressure is controlled by changing the diameter of the blood vessels. Stretch receptors monitor the pressure. And pressure can be increased or decreased depending on the situation. So let me break this down for you guys. Okay. Arteries are the only blood vessels that can change in size. They dilate and they can constrict based on whatever your body thinks your blood pressure should be. And there's other factors too, but we'll make this very simple. Okay. So your body's constantly monitoring, what's your blood pressure? What's your blood pressure? What's your blood pressure? This situation, you're in a stressful situation. Well, we need to increase our blood pressure because something's going on. You have adrenaline going, things of that nature. Okay. So your body will actually shrink your arteries down just a little bit to create a higher blood pressure. Okay. Now, if something affects that whole system, whether it be bleeding out or head trauma or drugs, toxins, things of that nature, all right, your blood pressure can be affected. So if for some reason your body decides to just dilate all your arteries in your body because of whatever reason, your blood pressure is going to tank. That person is going to not be getting adequate supply of oxygen and carbon dioxide being exchanged. And the person's going to be real dizzy. And this can be a major cause of people just syncopal episodes, which means they pass out for kind of no reason. There's a lot of different things. So the blood vessels are very important in maintaining blood pressure. Okay. The body's always trying to maintain a blood pressure. All right, blood vessel dysfunction, loss of tone, okay? So the vessels can lose the ability to constrict and dilate. That's not good. There's different reasons for that. It can be old age. It can be many, many, many years of high blood pressure. Drugs and certain medications can affect these things too. It can be a side effect. Now, think about Viagra or any erectile dysfunction medication. What they do is they will dilate your blood vessels. It makes it easier to get an erection. So that is just an example of a medication that is intentionally causing an effect in the blood pressure. And we need to know that stuff too, because we need to know if we're going to be giving nitroglycerin. And again, these are things we'll talk about later in class, but there's certain medications that we can give that will also affect the blood pressure. And we need to know if the person's been taking any erectile dysfunction medication. Okay. So, so loss of tone. So it can lose the ability to constrict and dilate. Okay. That causes the pressure to drop. Okay. And trauma, infection, allergic reaction. Allergic reaction is another one we'll talk about later on, but that will cause the blood vessels to dilate as well. Okay, here's an example. So a normal vessel, see, it's got blood all the way through the vessel, and that's what your body's trying to maintain. But for some reason, whatever it is, like I said, a medication, allergy, trauma, those types of things, the blood vessels will dilate, and then your vessels, you don't have enough blood in your system to fill those vessels all the way up, and that causes a drop in the blood pressure. Okay, talk a little bit about the heart. The heart pumps an average stroke volume, which is the output of the heart, about 70 milliliters of blood per contraction. Okay, there's a few different pieces to this puzzle of the heart doing its thing. Okay, the stroke volume is based on the preload first. Okay, how much blood is returning to the heart? Again, our body is just a big cycle. So we have our oxygenated blood comes out of the heart to the body. Gas exchanges take place, and then the same blood returns to the heart. So how much blood is coming back to the heart in the preload? That means that the deoxygenated blood is now returning to the heart. Of course, that's going to affect the volume of what's coming out of the heart, right? If we cut a vein and we lose a ton of blood out of the venous side of our body, well, on the return side to the heart, you're not going to get as much of that preload. So that's very important that the body gets that so it can do its thing and the gases can exchange. Contractility, okay, how hard does the heart squeeze? Okay, and then afterload. The pressure the heart has to pump against to force blood into the system. So if your blood vessels are real small or you got blockages, okay, how hard does the heart have to squeeze to get that same amount of blood out to the body that it needs. Okay, so now if we take that stroke volume, which we just talked about, the stroke volume is based on these three things. It's roughly 70 milliliters of blood per contraction, and that's going to vary by age and size and all kinds of different things. That's just an average number right there, okay? But if we take that stroke volume, okay, we times it by how many beats per minute, which is a vital sign for us that we need to be able to calculate, okay? That equals the cardiac output. You may see questions on the test, again, at the stroke volume, the cardiac output, the tidal volume. You need to know what these things are. Don't get too excited about calculating, because we're not going to be able to calculate those things, but we do kind of just need to know what they are. All right, so make sure you look up your definitions and understand what these things are. Okay, slowing heart rate or decreasing stroke volume can reduce your cardiac output. This is just like the minute volume we talked about in the respiratory section. Obviously, a slower rate or the decreasing amount of volume is going to affect your end result as far as output goes. Okay. However, a very fast heart rate can reduce the cardiac output as well. And the reason for that is, and that's why we get a little nervous when people have a real high heart rate, because they can't refill fast enough in between beats. Your body can only move that blood around so fast, and it's kind of a perfect balance when everything's working normally. But if you get that heart pumping way too fast, then you're not going to be able to get enough blood into the heart for the pre-fill section of it. So you're going to be kind of just squeezing air, right? And we don't want that. So real high heart rates are not a good thing either, okay? Heart dysfunction, okay, there's mechanical problems such as physical trauma, pressure in the pericardial sac, or cell death, the heart attack itself. Could be some mechanical problems of the heart, okay? And that pericardial sac is just it's a sac that's around the heart, and certain conditions or trauma can actually pierce that sac. And what can happen is blood can get in between the sac and the heart itself, and it puts pressure onto the heart, okay? So those would be some sort of mechanical forces. And we'll talk about more about those types of conditions when we get to the cardiac section, cardiology section, okay? So we have our mechanical problems. We also could have electrical problems, and we can damage the heart's ability to regulate the rate. And those can be as simple as an electrolyte imbalance that we mentioned earlier. It's very important to have those electrolytes and have them not watered down by literally too much water, okay? So mechanical problems, we have electrical problems. So let's put the two systems together. The entire cardiopulmonary system must work together to maintain life, okay? There must be a balance between ventilation and perfusion for system to work properly. This is referred to as the VQ match. I don't know where the Q comes from. Ron may know, but ventilation is V, perfusion is Q, so they call it a VQ match, all right? Any breakdown in the system impacts the ratio and can cause possible life-threatening situations. So the whole point is that the cardiac system and the pulmonary system need to work together. They do work together. And they need to both be working properly. Otherwise, it's going to screw the other system up. Okay? We shall talk about shock now. Okay? Perfusion. This is something you guys definitely need to know. Okay? Perfusion, by definition, is the regular delivery of oxygen and nutrients to cells and the removal of waste products. Okay? So your body is perfusing properly. Okay? So now back to our medical terminology. Hypo meaning low. Hypoperfusion is referring to the breakdown in that system. Okay? It can cause death in the patient. So shock, there's many types of shock, and we will talk about how to treat shock and the different types of shock throughout this class. But it's a very big component of basic EMT is to be able to identify shock and know what's going on and realize how important it is. So again, perfusion is the regular delivery of oxygen and nutrients. So it means that things are working the way they're supposed to. You're perfusing properly. oxygen and nutrients around the body. Hypoperfusion is when that system breaks down for whatever reason. There's 4 different categories of shock. There's actually a few more, but it's okay. There's always something above and beyond what we're learning, okay? But these are the ones we kind of need to know about, okay? Hypovolemic. So let's go back to our medical terminology. Hypo being low, volemic is the volume of blood, so a decreased volume of blood. So somebody's bleeding out somewhere. It could be internal. That's not good. Now, if you get somebody with a severe cut on their wrist or their leg or whatever it is, usually we can put a tourniquet on that and we'll be good to go. If there's some severe internal bleeding going on, nothing we're going to be able to do for them. But if we can identify it and we can get that person to the hospital quickly, then we might be able to save their lives, okay? So that was hypovolemic. Distributive shock, okay? We have our septic shock. It's essentially, it's an infection in the blood. Anaphylactic shock, or we're talking about our allergic reactions, which we'll get into more later on in class. Neurogenic shock, so we have a problem with the nerves. Okay, cardiogenic, we have pump problems, and obstructive shock. We're talking about the vessels themselves, and they're often grouped with cardiogenic shock. So we have some type of vessel issue. Okay. So your body's pretty good at regulating your blood pressure, like we talked about already, your respiratory rates, all those things. So now when we start to see changes in those things, again, the fast, slow breathing or the fast breathing, okay, skin conditions, very important. Okay, your body says, whoa, 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 something's off here. Something's going on and we need to compensate, okay? So this is called compensated shock, and it's kind of hard to identify the compensated as much as the decompensated, which we'll talk about in a minute, okay? But when the body's starting to compensate, we might see some slight mental status changes. So that people might be starting to get a little bit confused, okay? Might have a little bit of an increased heart rate, respiratory rate, capillary refill time. If you want to just real quick, look down at your hands and squeeze the top of your fingernail, any of your fingers. If you squeeze it, you see it turns white. Now that should refill in just a couple of seconds, 2 to 3 seconds. That should be red again, or pink, whatever color, okay? So when you squeeze it, it's white, you're pushing the blood away from that area. When you let go, it should refill with blood super quick. If your body takes too long to refill that area, that's an indicator that something's going on here. It could be a sign of shock. Now, we don't really use capillary refill as a vital sign. This is kind of just an extra tool in your toolbox. It can be something you check out. It's a lot more effective on children, and kind of the reason for that is because kids can compensate really, really well. Unfortunately, you could show up to a trauma and have a kid there and they're fine. They appear good to go, like no issues at all. And they will just compensate and compensate and compensate until they decompensate. And it's very, very dramatic, very quick. And then they can just be dead. Those are types of pediatric challenges that we have. But the capillary refill time is a kind of a good indicator for children. So feel free to just squeeze the thumbnail on your patient and just take a look. I mean, again, it's not an official vital sign that we'll be teaching, but it is an extra tool in your toolbox to just assess your patient, okay? Skin condition is very, very good indicator of something's going on with your patient. So pale, cool, clammy skin and sweating. So they're diaphoretic. So we see our mental status, our increased heart rate, increased respiratory rate, the clammy skin, okay, they're sweating. Those are big, big indicators that there's some shock going on in this patient. And you can disregard that asterisk at the bottom. The 3-2 class is the dates are obviously a little bit off on this PowerPoint. I need to update them. Okay, so this is just a video. We'll send these PowerPoints to you also. I'm not sure if this has a link in it or not, but the video is not attached to this. But there's just a video of carbon dioxide transporting throughout the body. You can look it up on YouTube. Usually pretty short videos that are attached to these PowerPoints. All right, pathophysiology of other systems. Okay. The body is about 60% water. Okay. 70% of that is intracellular, meaning it's in the cell. Okay. Intravascular is about 5%, means it's inside the vessel. And interstitial means it's between all the cells, roughly 25%. But yes, the body is about 60% water. Okay, just a picture about the fluid balance here. So it's the water is distributed in 3 different places. All right, if there's disruptions in the fluid balance, fluid loss, dehydration, decrease in the total water volume, poor fluid distribution, the water's not getting to where it needs to go, edema, meaning there's too much water in some parts of the body. All right, those are going to be some disruptions in the fluid balance. Edema is basically, looks like swelling. Pedal edema is a big indicator of congestive heart failure, where you'll see your patient has really swelled up feet. And you can kind of push on it and just, sometimes it'll kind of stay pushed in where you did. It's not always, but if they have some swelling going on in their feet, that's edema. You can get pulmonary edema from congestive heart failure as well, so they have a lot of fluid in their lungs. But basically, there's water in areas that it's not supposed to be, and it causes some type of swelling. And usually, it's pretty easy to identify. Okay, the nervous system. The brain and spinal cord are well protected by the skull and the spine. Okay, they're covered by several protective layers and a layer of shock-absorbing fluid, cerebrospinal fluid. Okay, still subject to damage from trauma or disease. So there's ways that protect your skull and spine, your nervous system. Okay, but there's ways that system can be damaged as well. All right. So trauma, motor vehicle crashes, falls, diving accidents. Okay, dive off into a shallow pool that can break your neck, cause all kinds of issues, car crashes, falls. So when we respond to these types of calls, we need to be thinking about these things on the way to the call. So this is a vehicle crash in a 55 zone, and it was a head-on crash. There's a good chance somebody's really messed up here. Okay, you're dispatched to a fall. Well, dispatchers are pretty good about asking good questions. How far did he fall? Is he breathing? Is he moving? Is he complaining of anything? Okay, he fell off a 4-story building. Okay, that's not good. So we are probably going to have some serious trauma here. All right. Different medical dysfunctions can affect the nervous system as well. So stroke. Stroke could be either a blood clot that gets stuck in the brain or a blood vessel in the brain pops. Usually the clot, if you catch it quick enough, they can break that clot up and people can return to normal, no problem. But if it's a broken blood vessel in the brain, that is less likely to be able to be fixed. But either way, with a stroke, we need to get moving very quickly. Okay, certain infections can affect the nervous system. Meningitis, encephalitis. Different diseases can affect the nervous system, and low blood sugar. And again, we'll get to this more in depth in the altered mental status diabetes section, but we're talking about hypoglycemia, hypo being low, glycemia, we're talking about the glucose levels in the blood. Okay. The endocrine system secretes hormone, the glands secrete hormones. The hormones send chemical messages to the body to control body functions. Okay, major organs in the system, talking about our brain, kidneys, pancreas, pituitary gland, thyroid gland, adrenal glands. Okay, you should know where these things are located in the body. You should know roughly what they do. Okay, or endocrine system dysfunctions, organ and gland problems present at birth or result of an illness. A lot of times people are born with these things, not always, but a lot of times they are. Too many hormones, like Graves' disease, there's too much thyroid hormone. Most of these things can be regulated with medication. Too many hormones can cause problems with the heart rate and temperature regulations. Not enough hormones could be diabetes. We're talking about insulin there. And again, we'll get into that in a later section. All right, the digestive system allows food, water, and other nutrients to enter the body. Major organs of the system are the esophagus, the stomach, and the intestines. All right, different dysfunctions we could see. This system, of course, will affect dehydration levels and nutrient transfers. So GI bleeding. GI bleeding is something that you'll probably come across at some point in your EMS career. There's a very distinct smell associated with GI bleeding. Okay, there can be slow or there could be fast bleeding, but it basically means that blood is coming out of one end or the other of the digestive system. So they're either vomiting it or they're pooping it. All right, it can be a slow chronic bleed. So a little bit of blood's getting into the digestive system. Their body is digesting that blood a lot of times, or partially digesting it, and then you poop it out. And it's usually dark, loose stool. Okay. If there's a faster bleed or like a lower GI bleed, sometimes that can be more bright red blood. So it is kind of important for us to ask if we're going to one of these types of call, like what's it look like after you're done on the toilet? Is it red blood looking or is it digested blood looking? Because the doctors will need to know that. Okay. Vomiting and diarrhea are parts of the digestive system dysfunctions. Most common disorders. There's a variety of causes. It could cause malnutrition and dehydration because you're not getting enough water or food to your body like it needs. Okay, but there can be signs of an MI, which is a myocardial infarction. We're talking about a heart attack here. That's the technical term. Okay, stroke or brain injury. Okay, a lot of people who have a heart attack feel real nauseous, and especially females present this way, usually differently than males do for whatever reason, I don't know, but just the nausea and the vomiting can be a sign of a heart attack. Okay. The immune system is responsible for fighting infection, responds to specific body invaders by identifying them, marking them, and destroying them. Okay, hypersensitivity, we're talking about allergic reactions here. Allergic reactions to certain types of foods, drugs, or other substances. It results in an exaggerated immune response. The chemicals affect more than just one invader. So your body thinks that peanuts are bad, so it sends your immune system into exaggerated mode. It says, go attack those peanut molecules. And they overdo it, and the body essentially starts to fight itself. And this can cause some serious problems. Me personally, I learned recently that I'm allergic to bees. I am a beekeeper, so there are treatments out there for allergies, certain desensitizing methods. So essentially that's what happens to me though. If I get stung by a bee, I will get a rash, I'll get hives, blood pressure will drop, just all those signs of shock that we talked about. I've never had anything super severe, not yet anyways, so I'm working with the allergist to try to get that taken care of because I really like keeping my bees. So, but yes, so your body, my body, when I get stung by a bee, has an exaggerated immune response. Okay, it can produce edema, rapid drop in blood pressure, and can be life-threatening. Now, ask yourself, why would there be a rapid drop in blood pressure? Think about back to the shock symptoms that we talked about. When we talk about the arteries constricting and dilating. So if your body all of a sudden opens up all your blood vessels in your body, you are going to have a drop in blood pressure. It can produce edema. So you're going to have swelling in that area. I got stung in the face a couple of months ago, and my face was swollen for 3 days. And I had edema in my face, and it was just soft. You know, my eye was closed, everything. I'll show you guys a picture of it sometime. But yeah, it was interesting. All right, real quick review, okay? Pathophysiology allows us to understand how negative forces impact the normal function of the body. Okay, pathophysiology helps us understand how common disorders cause changes in the body. Understanding how the body compensates for insults sheds light on the signs and symptoms we may see during assessment. Okay, that's why it's important for us to understand the pathophysiology, because if we see the signs and symptoms, we might be able to trace it back to whatever's going on with this patient. Understanding what compensation looks like helps us rapidly identify potentially life-threatening problems. Again, the shock we're talking about. Okay, if your body is compensating, the increased heart rate and all those things that we talked about, okay, it'll help us identify what possible life-threatening conditions. Okay, remember the shock occurs when the cardiopulmonary system fails and cells become hypoperfused. Okay, we have to know about shock and what the signs and symptoms are and how to treat it, which we will get into. The body is composed primarily of water, and this fluid is distributed throughout the body's systems, and it needs to be in the right place and not pool up in places it doesn't belong. Okay, just a question to consider. This is not a homework question, but just something for you guys to think about, all right? When evaluating a patient with a cardiac problem, consider the impact on the respiratory system. When evaluating a patient with a respiratory problem, consider the impact on the cardiovascular system. What impacts do problems in these systems have on each other? So just think about how the two systems work together. And if one of them starts to malfunction, how is it affecting the other system? Because this is why we have a cardiopulmonary system. It's actually two systems that work together, and they have to work together perfectly. Okay. Shock must be recognized immediately. What is the pathophysiology of shock? We talked about this a lot. Okay. Just think about shock. Think about what's going on in the body. What's causing those signs and symptoms? Is it an opened up artery? Okay. And that is the end of this show. All right. And I will upload this now, and I will get to work on the next section. All right, I'll talk to you guys soon.